Hello, everyone. My name is Kelly Moore with More Benefits, and I'm happy to present the CTS Cement 2018 Benefits Open Enrollment Overview. So just wanted to let you know that I think that CTS Cement does a great job for its employees by providing a very rich benefits program. For the 2018 plan year, we are going to continue with the same carrier we had before, which is Anthem Blue Cross. They originally came back with a pretty steep increase, 17.9%, which we negotiated down to 8%. So other than the rates going up, there's one small change to the medical plan, but otherwise the benefits remain the same. And I also wanted to just kind of update you, healthcare reform, it's still the law of the land as much as it's been going back and forth. So at least as of this time, everyone should have affordable health insurance made available to them. And CTS still does that. Just an overview, there's Anthem Blue Cross for the medical, dental, and vision, and a health savings account through Health Equity or the PayPro flexible spending account. And the way it works, if you have the high deductible HSA compatible PPO plan, you would have the corresponding health savings account with CTS's contribution of $500 per year. If you have the HMO plan, you would have the flexible spending account with a $500 contribution from CTS. Also very unusual. We have no clients that do that. So very great. Eligibility is first of the month following 60 days, and you have on this sheet here in this book that we're also sending how to find a doctor on Anthem. You just go onto Anthem's website and search as a guest if you're not enrolled through my employer. But if you are enrolled in Anthem, the best thing to do is to log in, register yourself. It can find you by your member ID and your date of birth, or your social security number and date of birth. And then you'll be able to navigate directly to the network that you are currently enrolled in. You don't have to worry about figuring out which plan it is. But if you aren't yet enrolled, you can see that the HMO is the Blue Cross HMO California Care Large Group, or PPO Prudent Buyer Large Group, Dental Complete, and Blue View Vision. The reason why it's so important to have an in-network doctor is because the benefits are much better in the network than they are out of network. And being this is open enrollment, it is the only time that you are allowed to add, drop, or change your coverage, unless during the plan year you experience a qualifying event. So if you have a change, you or your spouse has a change in employment status, then you would be able to make changes to the plan that are consistent with that change. So if you get married, you can add a spouse. If you have a baby, you can add the baby. Or if your spouse gains or loses other employment, you can add or drop the coverage. But what you can't do is change back and forth between the HMO and PPO. So it's important to decide what's the best plan for you during this open enrollment period, because you're stuck with it for the whole year. Here's a summary of the two plans. The classic HMO plan, same kind of plan we had last year, no deductible, preventive care is always 0% no charge. Primary care visits are $30 and specialists $40. On that, you'll have to remember on the HMO plan, you select a primary care physician, and they're generally affiliated with a medical group that will coordinate all your care. So you will need to get a referral to a specialist from the primary care doctor before you can see that specialist. And if we drop down here to the out-of-network benefits, there are no out-of-network benefits except for true medical emergencies where the $100 copay would be paid as if it were in-network. Otherwise, if you need to change your medical group or your doctor, you will need to contact Anthem Blue Cross before the 15th of the month, and then it will be effective the 1st of the following month. If it's after the 15th, it'll be even the month after that. So the important thing is to go to the doctors that are in the network that you have. Diagnostic tests are no charge. Imaging is $100 a test. And the prescriptions are $5 for generic. And then if you get a brand name drug, you'll have a $150 annual deductible per person. And then your copays would apply, 30, 50, or 30% depending on what tier in which they fall. And those tiers pretty much describe the cost level. So the more expensive drugs will be on the higher tiers. If you go into the hospital, it's just $500 per admission, no matter how long you're in there. And the out-of-pocket maximum is the most that you would pay in a calendar year. So it's $2,500 for an individual, $5,000 for a family. And that resets in January of every year. The other kind of plan is a PPO plan that is HSA compatible, Health Savings Account compatible. And so that means that this plan has a higher deductible. It's $1,500 if you have single coverage, or if you're in a family, then the first member who incurs charges will have a $2,700 deductible, and then it's capped at $3,000 per family. So let's say you have 4 people in your family, for example, and one person goes into the hospital. Then that person would have a $2,700 deductible, 20% coinsurance after that, which then goes towards the out-of-pocket maximum of $3,000. And then that person's coverage would be paid at 100%. Now let's say the second person in the family goes in the hospital. Since we already have $2,700 of it that had been met, there would be only $300 more for that person to meet. Then it would be 20% after deductible, and that would go towards the $6,000 out-of-pocket for the family. And then let's say a third person goes into the hospital. Deductible has been met, out-of-pocket has been met, so everything would be covered at no charge. Now you'll notice on the HSA compatible plan that office visits are still subject to deductible and coinsurance. And that is true of every type of charge except for prescriptions. The prescriptions are also subject to the deductible, but there are flat copays of generic can be either 5 or 15, depending on the overall cost category in which they fall, and then tier 2 and tier 3 and tier 4. The tier 4 drugs at 30%, those are going to be the really high cost injectables, and they have a $250 a month copay limit. With the PPO Health Savings Account compatible plan, you have access to benefits out of network, but you'll see that the deductible is quite a bit higher, coinsurance is higher, and the out-of-pocket max is higher. In addition to that, providers can balance bill for amounts above and beyond what the PPO discounted rates are. So it's always better, your benefits go a lot farther if you stay in the network. Here's a list of just kind of a more detailed definition of what the annual deductible, copays, and coinsurance and out-of-pocket maximums are, and the different plan types. Preventive care services. Both plans provide 100% coverage for preventive care, even the high deductible plan. So we know that some people may not go in for their annual routine physical because they think they have a high deductible plan. Well, that should not matter because it'll be covered at 100%, especially if it's coded correctly by the provider. That's one thing that sometimes we'll hear people grumble that they went in for their routine physical exam and ended up with a copay of, if you're in a high deductible plan, it's really a lot because it's like $100 or something like that. And when you get back into the codes that the doctor provided, there were some diagnostic conversations going on, trying to resolve aches and pains or illnesses. And so whenever you go in for preventive care, I think it's important to let the provider know that your intention is to have preventive care services. And it's also interesting that your flu shots, there are other kinds of vaccines like pneumonia vaccines, the tetanus, all those vaccines are preventive care and are covered at 100%. So please don't miss out on that because of having a high deductible. The other type of coverage, and you know what, actually, I want to go back to the medical plan again and talk a little bit about emergency room versus urgent care and where you go to receive these services. Emergency room should be reserved for life or limb-threatening emergencies, apparent heart attack, loss of consciousness, things that have a very severe nature. If it's something where you can think about it and call someone, it's probably going to be an urgent care visit because you would, stitches maybe. So that way you will not only pay less money, but you'll be waiting a lot less time. Another option is to call the nurse line, which is free, or to use the Live Health Online service. And that's just a service where you can request to see a doctor on your smartphone or tablet or a computer with a camera, put in your symptoms. You can even take pictures, and the Live Health Online will show you what doctors are available. And for a $49 charge, you'll be able to spend time face-to-face with a doctor on your phone. And they also have the ability to prescribe medication in California and in most states. And it's something that you could use when you're traveling as well. Just a way to keep costs down but still get the care you need. The other benefit that CTS in Rapid Set offers is dental coverage. It's still going to be with Anthem, and that's good because then the medical, dental, and vision plan providers can coordinate so that if something comes up in your health that affects the other part, then the providers can be notified. So, for example, if you're pregnant, you may need to have another cleaning during the year, and so that would be passed on to the dental coverage carrier. With the dental plan, there's an annual deductible of $50 a person or up to $150 for family. Preventive care, which are the cleanings and x-rays, the bite wing x-rays and so on, that they do twice a year, are covered at 100% with the deductible waived in network. Basic procedures like extractions and fillings are covered at 20% after the deductible. They're covered at 80%, you would pay 20%. So if it's crown, that's also 50% after deductible. So if you have a $1,000 crown, then you would pay the first $50 and then you'd pay 50% of the balance up to the calendar year maximum benefit. Now we were talking about the medical where after the out-of-pocket maximum is met, the insurance pays 100%. The dental coverage is just the opposite, where you have a bank of $1,500 at the beginning of each plan year, and as you get your teeth cleaned and have any type of services like a filling or a crown, that would reduce this calendar year maximum benefit. The child orthodontia is only for one time a year use. I'm sorry, one time per lifetime use. So for child's braces, the plan pays 50% up to $1,500. And you can see that if you end up with some crowns and orthodontia that you may be out of pocket quite a bit of fees that may not be covered by the plan. And as we get to the flexible spending account, just thinking about that, that's a way for you to pay for that on a pre-tax basis. Out of network, it looks like the benefits are exactly the same, with the exception of the preventive care being after deductible instead of before the deductible. But out of network, the dentists do not have to accept the PPO discounts that the in-network dentists have accepted. So if they charge more than the PPO discounted rate, then they can balance bill you. Like for example, if a teeth cleaning is $150 for your dentist who's out of network, but Anthem only allows $100 for a cleaning, then they're only going to pay 100% of the $100, not the $150. So again, your benefits will go farther if you're using an in-network provider with the dental plan. With vision coverage, there's a $25 vision exam copay and $15 for your materials, whether it's lenses or contact lenses. And your frames are covered at $130 allowance. Then you have a 20% discount after that. These are provided every year for you. The vision is also with Anthem Blue Cross Blue View because there are several different illnesses that can be diagnosed simply by looking in your eyes, like, for example, diabetes. And this is also something that Anthem has worked on the whole you so that as things go across medical, dental, and vision categories, that you have access to that in a consolidated fashion. So, okay, so the eye exam, $25, $15 for single, bifocal, or trifocal, or even progressive lenses. The frames, if they are over $130, you'd have a charge. Now with the contact lenses, they have two different categories, elective and medically necessary. If they're elective, so it's cosmetic only, you could wear glasses, then you'll just get a $130 allowance. Otherwise, if it's medically necessary, then it's just a $15 copay. If you go out of network, they will reimburse a portion of the cost, but not very much. And so it's nice to find somebody who's in network. One question that we get a lot of is, what if something happens to my eye and I'm injured or I have some sort of illness in regards to my eye? That's not what this coverage is for. This vision coverage is for refractive, nearsighted, farsighted correction. Anything wrong with your eyes' health is covered under the medical plan. Okay, health savings accounts. So if you have the high deductible HSA compatible PPO plan, CTS Cement will be providing a $500 deposit to that account every year. And then you have the ability to to add more to the plan. If you're a single medical coverage subscriber, the total is $3,450. So you'd have to reduce by $500 what you could put in there that CTS is already putting in. If you have family medical coverage, whether it's employee and spouse, employee and children, or employee and family, this is the limit. So if CTS is already putting in 500, you could put in 6,400 more. And you would be able to do that either by writing a check directly to Health Equity or to let Sarah know to take it out of your paycheck on a pre-tax basis. The bonus there is that you would have the exemption from state tax as well as federal, which you don't have if you just write a check. And the reason why these are really great plans is that you have a lot more freedom about how you use it, because it isn't just things that are covered by the medical, dental, and vision plan. There's a pretty long list of things that are covered. Sarah will be getting a more comprehensive explanation of health savings accounts that she's going to pass on to people. But the good thing is the money goes in tax-free. It earns interest tax-free. And when you take the money out using it toward eligible healthcare expenses, it's not taxed now or later. So you would be able to save up money in your account over time. And when you reach age 65, you can't contribute anymore, but you can start using it to cover Medicare premiums or long-term care premiums. In fact, if you're age 55 or older, or you will be in 2018, you can put in another extra $1,000 to build up the account faster. A flexible spending account is for those who are in the health HMO. So it's similar to an HSA with a key difference. It doesn't roll over except for up to $500. So for 2018, you could deposit $2,650, but you would need to use up $2,150 because only $500 can roll over. So this isn't the kind of account you try to build up and save over time. This is for known, predictable medical expenses. So if you already know how many times you're going to go to the doctor, or you know you're going to have a surgery, or you know about a crown or some braces for your child, eyeglasses, any kinds of chiropractor, acupuncture, prescription drugs, and over-the-counter items such as bandages, pregnancy tests, and blood pressure monitors, if you know you're going to have these expenses, you calculate exactly what you think that's going to be and put that money in. Then you'll get your debit card to be able to pay for these when you use them. The thing about over-the-counter healthcare items, just for that, this applies to both HSA and FSA, is you can only use the funds for over-the-counter drugs if you have a written prescription for them. So that's one thing to take into account. You can't like stock up on aspirin to spend up the money. The dependent care FSA is for care for your child under age 13, before and after school, babysitting and nanny, daycare. The thing that it doesn't cover is tuition for school, grade school or anything like that. You can also use this $5,000 a year for a spouse, perhaps, or parent that you have to pay for care so that you can work. So dependent care FSA is only eligible to a couple when both parents work, at least part-time. So that's the way that works. The FSA, the entire annual election is available on day one. Dependent care FSA, the funds are available as soon as they're deposited into your account, and you can't overdraw this account, whereas you can the health FSA. The HSA, the money is available only when the funds are accumulated into the account. This account also cannot be overdrawn. Okay, so those are some pretty good tools to help you better afford health care and the costs of taking care of yourself. The value of pre-tax benefits is that you actually kind of give yourself a raise, because if you think about it, if you're paying $2,400 a year on a $30,000 income. If you paid it without pre-tax, you'd get your paycheck, get taxed, and then after tax you'd pay it. So your take-home pay is around $20,000. Of course, if you took the deduction out, then calculated taxes, you can see your taxes at a 25% tax rate are much lower. So therefore, that same $2,400 only reduced your paycheck by $600 less than it would have otherwise. Hope that makes sense. There are some legal notices in here just to let you know about your privacy, the fact that you would be eligible for COBRA if you leave, and family and medical leave, the children's insurance program. So all these legal notices are here for your convenience, and also our contact information. There's Anthem, and the HSA has a different number than the HMO traditional PPO. So for you guys, just this first one is HMO and the second one is your PPO. Pharmacy, the vision. Here's another good thing to know about, the resource advisor. This is an employee assistance plan to help you through troubled times, somebody to speak to 24/7. Same thing, the 24/7 nurse line is here, but I myself prefer the Live Health Online program because the nurse line, they are not able to prescribe medications. And honestly, most of the time they're pretty conservative about any advice at all. So it might be worthwhile just to know that the Live Health Online is there. More Benefits, that's the company where I work. If you email hq@morebenefits.com or call our toll-free number, we can help you save time for things like claims question, benefit questions, advice on what to enroll in, for example, this year, lose an ID card, just lots of things like that. It can save you time, save you money if you let us help you. So with that, I will unmute and see if there are any questions. Okay, you're all unmuted. Charlie, Miguel, Sarah, do any of you have any questions? Is that a no? All right. Well, again, this I just wanted to share this. There's a little video here. It's not going to come through very well on my computer, but it is something that people really like.